Hello everyone, this is our final dynamic movement analysis project by Heather Cowden and Rekha Tabjula. The activity we chose to complete is a dynamic movement analysis on shuffling a deck of cards. The method I am using in this video is the modified overhand shuffle. Playing cards and shuffling cards for games can be a play, social interaction, or leisure occupation that many people find meaningful. The two videos seen are two of the primary motions analyzed, one in the right upper extremity and the other in the left upper extremity. Cards are sitting in the left hand on the palmar surface tucked under the PIP joints of digits 2 through 5 and IP joint of the thumb. There are three phases for shuffling cards. Phase 1 is the initial position to start. Phase 2 is pulling and using the force to separate the cards into alternate hands. Phase 3 is holding and replacing the cards back into the deck with the right hand. Shuffling cards is a quick, dynamic movement. The phases represent different patterns between both left upper extremity and right upper extremity. The left upper extremity is stabilized at the shoulder, elbow, and wrist, but requires flexion and extension at the CMC, MCP, PIP, and DIP joints of the thumb and fingers. The right upper extremity has a gross motor pattern where the shoulder and elbow are responsible for bringing the cards out to pull and back to place the cards on top of the deck. So there is a pull, opening left hand fingers, pushing the cards back, and closing movement, alternating between the left and right hand. Phase 1 is the initial position. The right upper extremity and left upper extremity are similar in position and joint action. During Phase 2, the right upper extremity pulls a few cards out of the deck. Doing so, the right upper extremity has more distinctive gross motor patterns, including shoulder external rotation, elbow flexion, and maintaining that wrist hyperextension, whereas the left upper extremity is still stabilizing the other half of the deck during Phase 2. Phase 3 is the most important phase since it is when the cards are replaced and shuffled back in. The right upper extremity displays gross motor patterns such as the elbow moving to extension and the wrist moving from hyperextension to flexion, also known as the flick of the wrist, or moving back into neutral. The left upper extremity moves from a stabilizing position to active movement from flexion to extension at the thumb joints and the PIP and DIP joints of the digits. The following slides indicate the joints and its components, followed by the muscular involvement during each phase. During Phase 1, joints are similar between the left upper extremity and the right upper extremity. The actions and angles starting with the shoulder are internal rotation, at the elbow is flexion, the wrist has hyperextension, the MCP of the digits 2 through 5 are at flexion and adduction, the joints of the thumb, including the CMC, MCP, and IP, is at flexion, and the joints at the PIP and DIP are flexion and adduction. The agonists or prime movers are listed with the antagonists here. During Phase 1, the muscles in both right upper extremity and left upper extremity are in an isometric contraction to hold the arms up against gravity in preparation for the anticipated movement. In Phase 2, there is a difference between the left upper extremity and the right upper extremity in its joint motions and muscular involvement. Angles are also stated here in this phase. The left upper extremity maintains flexion and similar hold since it does not move during this phase. The right upper extremity, on the other hand, moves from internal rotation, as in phase 1, to external rotation of the shoulder in phase 2 to pull some cards out of the deck. During phase 2, the muscles in the left upper extremity are still in an isometric contraction to hold and grip the cards while maintaining the arm upright. During phase 2 of the muscles in the right upper extremity, an isotonic eccentric contraction occurs at the shoulder during external rotation. At the elbow, an isotonic concentric contraction occurs for flexion. During phase 3, the left upper extremity becomes more involved at the distal end of the hand, at the thumb and digits. At the thumb, the CMC, MCP, and IP joints move from flexion to extension, and the PIP and DIP joints of the digits move into extension to allow the right upper extremity to restack and shuffle the cards back into the deck. The right upper extremity moves from the external rotation at the shoulder back to internal rotation with slight extension of the elbow to reach out to the left upper extremity. Again, the angle measurements are provided as well. The left upper extremity muscles primarily maintain an isometric stabilizing hold at the shoulder, elbow, and wrist, but there is an isotonic eccentric contraction occurring at the distal joints of the hand, which includes the joints of the thumb and digits. In the right upper extremity, since the shoulder is moving back towards midline, there is an isotonic concentric contraction occurring for internal rotation. There is also an isotonic concentric contraction at the wrist as the right upper extremity flicks the wrist to place the cards back into the pile. The elbow elongated to reach the left upper extremity results in an isotonic eccentric contraction. The muscles involved are identified here as well.
There are various techniques to shuffling a deck of cards, each requiring different movement patterns. However, one is not considered more ideal than another. We are analyzing a modified overhand shuffling method with some slight deviations from the norm of overhand shuffling. Typically, the deck is held at approximately a 45-degree angle to the surface, while cards are moved from the bottom of the deck to the top along the long side of the cards. The wrist would typically move with greater ulnar deviation and a slight rotation. Joint angles in the DIPs would generally be slightly larger, as the DIPs would not need to be flexed as much to hold the deck at an angular position. Other shuffling techniques with different movement patterns include a rifle method, which utilizes more symmetrical movements between the left and right hands, and a weave method that requires less dynamic movement at the wrist, but similar grasping patterns and joint positions of the DIPs. The technique a person uses is generally a matter of personal preference, but physical abilities such as bilateral coordination skills may be a factor. Certain medical conditions may affect one's ability to shuffle cards with the typical overhand method and may cause deviations when shuffling cards. This may include carpal tunnel syndrome, neuropathy, upper extremity amputations, general decreased grip strength, or lack of hand and wrist range of motion. These conditions may cause one to lose their grip and drop cards or leave the person unable to utilize a bilateral shuffling technique. As occupational therapy practitioners, we often assess hand and grip strength as it can affect many functional activities. A decrease in hand or grip strength may cause frequent dropping of items such as car keys, or in this case, cards out of a deck. Grip strength is measured with a dynamometer, and pinch strength is measured with a pinch gauge. Grip strength tends to peak between ages 25 and 39 years old for both men and women, and continues to decrease with age. Because conditions such as carpal tunnel can cause pain and weakness in the wrist, hand, and fingers, deviations in shuffling techniques may actually be necessary or more ideal than the standard overhand shuffling technique. If cards are being dropped or grip cannot be maintained to complete shuffling due to weakness in the hand muscles, one could perform hand exercises for increased grip strength. Therapeutic exercises may include using theraputty, scrunching up a hand towel on a table, or squeezing a stress ball. If someone is unable to utilize a bilateral technique as demonstrated, one can modify the task to a compensatory one-handed shuffling method, such as spreading cards around on the table to mix them up and then recollecting the cards. If the necessary skills are unable to be remediated and the task is unable to be modified adequately, we may look at adaptations for the task. As occupational therapists, we also may need to introduce adaptive equipment or technology to adapt tasks when necessary. If playing cards is a meaningful activity but shuffling is unable to be performed due to pain or physical limitations, an occupational therapist may suggest utilizing a shuffling machine as shown below. As previously discussed, shuffling cards would fall under the play and leisure occupation category. To successfully complete even a modified overhand shuffling technique, the body must utilize the shoulder, elbow, wrist, and finger joints and corresponding muscles as previously discussed. The simple task of shuffling cards involves many dynamic movements and body mechanics, making analysis of this movement complex, but essential when needing to restore this occupation for our patients. Thank you for watching our final dynamic movement analysis project.